My name is Audrey Nguyen, Audrey Nguyen Rudy, and I'm an assistant professor of practice at the University of Akron's Department of Biomedical Engineering. So I have been at the University of Akron. This is my fourth year now. So it's my third year as an assistant professor. The first year that I was at the University of Akron, I was actually a visiting professor in the same department. And I teach, primarily it's teaching. So I'm a non-tenure track or an NTT position. So my time is about 80-20 teaching and then service. And I teach classes primarily in undergraduate. So starting with the freshmen with their introductory classes, teaching them programming and SolidWorks. We get the sophomores with biomechanics, and then sometimes the juniors and the seniors with some of their labs classes, but I teach it all. So I try to have a lot of energy in the classroom. I try to be a little bit more exciting and active and engaging than maybe, a little bit of the older colleagues in some of their other classes, like their prerequisite like Calc 1 or Chem 1 classes. But I also try to make sure that they see me as a person. I try to ask them about, activities that they do outside of class, because I want to see them as complete individuals. I talk about, I'm very big into college football because I went to the Ohio State University and we're very, very excited about our football team. So we talk about that. But I try to just connect with them. I try to make sure that if they've got other exams that I'm conscious of it, I try to ask about what other classes that they're concerned about that semester. With the first years especially, I try to make sure that they feel supported, that they feel like they have a community. And I want them to start seeing themselves as biomedical engineers. I want to help figure out that identity and that place of belonging so that they, want to stay and matriculate through the program. With juniors and seniors, especially once they start taking a lot of the harder classes, I try to emphasize to them that, that they can do it. They've already come so far. And I maybe this isn't the best solution, but I try to tell them, like, I also struggled a lot with my courses. I've been very honest that I did not do well in my statics classes, and I should have, because it's not too bad once you really understand it. But I told them, I was like, I didn't do well in statics, but I took the time, I learned it, I relearned it, and we're going to get you all through this mechanics class together. And I think that being honest and transparent has come a long way in building trust and rapport with my students. I think it really depends on where they are, but I want to always be very clear. So like with every class, I try to be very clear from day one. We set expectations. We say, like, this is why we're doing this. We don't tell them what they're going to learn. We tell them why they're going to learn it. I always, like, with my first year students, I've been really trying to connect it with career opportunities, with all the different pathways that you can use a biomedical engineering degree. With my sophomores and my juniors, I'm like, you're going to be using this in your next classes. You will see this when you get to senior design. These are things that you'll see when you go to internships and co-ops. So I think building in a motivation for them has been really helpful, to try to connect with them and to try to get them to meet those challenges head on. But I also try to remind them for some things, like, especially like introductory classes that are very skills focused. So like programming in MATLAB or using SolidWorks for design. I try to, I started off with like, oh, how many of you can play a musical instrument? And a bunch raised their hand. I'm like, okay, how long did it take you to be good at playing your musical instrument, right? And that kind of helps to break down that barrier of, oh, if it's not easy right away, that's fine. It's actually something we should work on and be patient with ourselves with, and continue to practice, and eventually it gets easier. I talk about it like learning a language or driving a car. No one's good at it after one day, one week, right? So we try to like set up those expectations, try to be very clear. It is hard because it's engineering, but you can do it, and we're here to help. That's really good. So how do we set those expectations and challenge them at the same time? So I think it's, again, it's setting that expectation and trying to show them why a curriculum is built the way it is, how our class is structured to serve the needs of ABET, and why ABET's important. I think it's all very black box and mysterious to these students. They're just trying to get a good grade, to move through with their classes, to get careers going, right? But I think being very clear that the goal of this class is to teach you these things, and a successful student after this course can meet these outcomes, and we are building you to get towards those outcomes. And if you can do all those things, that's the A. And part of doing those things is coming to class, to take notes, to engage in discussion, to do your homework, to think critically about these problems, right? But I mean, I think, again, just building in that explicitness at every level. So it should be very clear in their syllabus what the goals of the class are and the course are, and how it fits in the grand scheme of things. And day one, when we introduce the class, I should be reiterating how, as sophomores, you are here, and we're going to bring you to this next level so that you are prepared for your future classes in this way. And then we talk about, again, building in that motivation. You'll use this in internships and cooperative experiences, in your senior design projects. But also every lecture I start off with, we're going to go over these things, and these are the objectives. If you can answer these 5 or 6 objectives based on the lecture material, that shows mastery. So it gives them a baseline for each smaller chunk of topic that we kind of go through. So I think having that explicitness at each level is really helpful to kind of set those expectations. Yes, so as it stands right now, it has been difficult to like make time to pursue education research, but I hope that is changing. So at least recently, having discussions with my department chair, he's been very supportive. He and the dean of the college have been very supportive in carving out some load hours for me to begin to pursue educational research, because it is very important to me, right? Right now, it's a lot of implementation. It's me going into the literature, trying to figure out those best evidence-based practices that I can use. But right now, we are also doing this inclusive teaching workshop with the members of my department, and I'm working with colleagues in the director of assessment at the university, as well as the head of the University Institute for Teaching and Learning. So they've been really wonderful in trying to get that going off the ground. So we're talking about, again, evidence-based practices with a focus on creating inclusive classroom environments. So that's been a really wonderful thing to do. And right now, the kinds of things that I would love to start doing educational research in really revolve around identity, community, and belonging within biomedical engineering. And that's something that I've really struggled with as finding myself, my own identity in biomedical engineering. I was pre-med for a long time. I came to grad school very late. I was very mechanics focused, but that doesn't mean that I'm less of a biomedical engineer than someone who does work in cells, or work in prosthetics, or work in genomics or drug delivery. So trying to find that sense of community and belonging, I think, is really important for our students, as well as they try to navigate, young adulthood, and trying to figure out where they belong. What else would I like the BEEC community to know? I mean, I'm here. I've been very interested in the education space. I'm relatively new to it, but I'm very excited to see it start to grow. I mean, the Biomedical Engineering Education Journal that very recently started through BMES. I know ASEE has been around for far longer in terms of education. But I think that there's a lot of really interesting things that are happening. And if you were at Biomedical Engineering Society, one of the keynote speakers or plenary talks, just to boil it down super quick, was very much like a motivational talk about how biomedical engineers are going to save the world. And I think that it's really lovely to be a part of that in such a tangible way as being an educator in the space. So please reach out. I'd love to talk. I'd love to collaborate. And yeah, thank you for having me.